Hi, my name is Hayes Gladstone, and I'm your host today for doing fractional carbon dioxide laser resurfacing. I happen to use the Cineron Candela CO2RE. I like it because it has a number of different facets about it where I can really customize the treatments from light to medium to fusion, and also deep for scarring. So it's great for many different types of facial conditions, from acne scarring to just facial aging with wrinkles and discoloration. And I can modulate it to what the patient wants in terms of downtime and whether the patient has a lot of wrinkles or not wrinkles, and just smoothing the skin, shrinking pores. Again, it's one of my workhorses I really love to use because it's so versatile. It does have downtime. Fractional resurfacing was revolutionary back around 2005, and the fractional carbon dioxide allows us to be safer than the carbon dioxide, which is the gold standard, but this gives us less downtime, but is still very effective. Generally, one treatment. Occasionally, for patients with deeper wrinkles, there can be may need more than one treatment. There is downtime. Generally, it's going to be a week, but unfortunately, we don't have a magic bullet yet in cosmetic surgery, but it's generally well worth it. I don't allow patients to wear makeup, but after a week, patients can wear cover-up. With this machine, generally speaking, on what we call the fusion level, which is the top level, in order to get the best results for many people, there will be 1 week of downtime, followed by about up to 6 weeks really of peakness, but it goes down, and people usually go back to work with 1 week. But again, there is downtime, but the results may take up to 6 to 9 months. Although there is an immediate tightening. What it does is, again, it smooths, it lifts a little bit, and tightens a bit, but it's very good at smoothing. Again, one of my workhorses, which I like, and get very nice results with this at the Gladstone Clinic in San Ramon, California. This procedure can be either done under IV sedation with an anesthesiologist, or it can be done under local anesthesia with oral sedation. I prefer the latter with oral sedation. I just think there's less downtime with this. I use a tumescent type of anesthesia with oral sedation, so patients don't need to fast ahead of time. They can eat right up to the procedure, and then afterwards they go home right away. They do need a driver, however, and they can eat right away without any nausea. You do have to use different settings determining on what anatomic part of the face or neck that I'm treating, and that's where some of the artistry and also skill comes in. But again, the Cineron Candela CO2RE, for me at least, there are many good fractional carbon dioxide lasers, but I like this because of its versatility. And then also, I'm going to show it over here. It's right over here. It's small, and so it's very portable. It's easy to move from room to room.